PG in Germany, the path less taken, but in the last few years and upcoming years, I do find that a lot of many people who are interested to come to Germany. So Germany, the country with a lot of beautiful cities, unlike tall skyscrapers in US, Germany is beautiful with very small buildings and beautiful gardens and so on. So I'll be discussing about why Germany, what are the pros and cons, and what are the courses that one can take up, and what are required, what are the exams that a doctor has to go through. Particularly, I'll be particularly concentrating about the MBBS doctors. I'm sorry for the dental doctors who are here. I don't have, it's quite different for the dental doctors here in Germany. For the doctors who are dentists, so if you're planning to come to Germany, it's going to be slightly different, although the exams are going to be the same, but the path of how you are, your career in Germany, it's going to be different. So I'm sorry, I won't be talking about dental professions here, if at all there are any dentists in our conference. So you can stay ahead and you can look into what are the requirements and examinations. That is going to be the same for all. And then I'll also be touching about what are the financial requirements, right from learning the language till coming here to Germany. And I'll also be talking about what are the real life experiences, what I expected as an MBBS graduate back then, and what am I looking into right now, and so on. Yeah. So why Germany? My main reason was I'm interested into medical equipment innovation and so on. So that was one of the main reasons why I came to Germany. And I also wanted to think about a place where residency or PG is free of cost. Yeah, obviously there'll be a lot of people who would say like, yeah, lab is also free of cost. If you clear lab, we can study in UK also. US also, it's the same thing and so on. But in Germany, you would have already seen that so many of our medical equipments which we use in India in many of the hospitals, you would find the roots of the equipment company being from Germany, especially in orthopedics or laparoscopy or whichever you see. All of them are mostly from German based. Germany has been one of the pioneers in medical equipment technology and innovations, and that is one of the main reasons why I always wanted to come to Germany, because I had an interest in innovations always. Technically, in terms of technical medicine, it's very much advanced. The devices which they use, everything, the way they do an ABG, which I have seen, we do ABG from radial artery and so on, but they do ABG from capillaries. They take blood from earlobe, which was quite new and interesting. I was like, how is this even? Why are you even taking it from earlobe? They said that's capillaries, that's where the gases are, and that's where it's better, rather than pricking the radial artery, which is difficult to find and it's very painful for the patient. So they're quite advanced in many small. That is one of the examples that I could tell you. And yeah, the other things that I also wanted to learn in a different country. So that is an opportunity to learn in a country where it has a good healthcare system. It has its own flaws, but it's a good healthcare system. They do a lot of research, and it's more based on evidence. So they talk in terms of what are the evidence, what are all there, and then they teach based on the research what they've done. And one can actually get into direct super specialization, and also you can join. Say, for example, if you want to become a cardiologist or a gastroenterologist, or you want to become a robotic surgeon, so you can do your general surgery, and then you can take into a course into robotic surgery just along with it. So it doesn't mean that like India, you will have to do 3 years of PG, and then we'll have to write NEET SS again, and then we have to go into super specialty programs. But here it's not like that. So once you start, you go on. You don't write an exam in between. So that's how it is. It's not like you will write an exam for general medicine or general surgery, and then you will write an exam for your super specialization like cardiology or neurology or gastro surgery or neurosurgery. So that's how it is here. So what are the pros and cons in Germany? So the pros first, compared to US, UK, and all other countries, Germany has a severe shortage of doctors. Even in the hospital where I work, there is a severe shortage of doctors. There are so many, we need more doctors actually. So it's not just in my hospital. There are so many other hospitals where they have severe shortage of doctors and also nurses. Last week, recently, I also found out through one of my from the HR that a lot of Indian nurses have come to our hospital. They are doing training right now. So yeah, there are better chances to get surgical and super specialty surgical branches also when compared to in US. I found that getting into neurosurgery, orthopedics is almost as difficult that it's not possible at all. But here it's quite easy. The main requirement is that we need to have a very sound knowledge of German language, and once you speak good German, it's quite easy to get into interviews and get the job or get the residency post. Salary is also good, yeah. In compared to, I would always compare with US and UK because that's the most popular option. So if I have to compare with now it's called as standards also. So if I have to compare with Germany, I would compare with US and UK. So compared to US and UK, the salary here in Germany is quite less because here in Germany we pay a lot of taxes. Work-life balance is obviously good here. Work is from Monday to Fridays. For PGs also, I'm talking everything in terms of PGs. We start usually from morning 7:30, the round start, and our job is done by 3:34 max. It's in all the hospitals, irrespective of what is the caseload. At 4, when your work's done, the work's done. The next duty doctor, who is, he has to take care of it. We have to just give the handover and leave. Unlike how we work a lot in India, here it's meant that when you work more than the work time. So if you work more than 4 o'clock in the evening, it means that we are inefficient. We're not able to complete the work given in the work time. So they say that it has to be completed with 4 o'clock, whatever it is. And Saturdays, Sundays are holidays for PGs as well. So that means in a month you have 4 weekends, and so that's 4 Saturdays and 4 Sundays you have. But you will have to do night duties and duties also on Saturday, Sunday. But it's going to be at least 1 or 2 Saturday and Sunday per month, not every Saturday and Sunday. So that is a good advantage. The freedom and flexibility to choose different fields. So say for example, one doesn't know which field they want to take. Either they want to take a medical branch or a surgical branch. Yeah. So they have such a, they don't have much idea about which PG to take, and they're confused. So they have not found out during the internship which field they like. So they like something. Say for example, they like dermatology and they get into dermatology and find that dermatology is not for them. They can switch to a surgical branch also. So they can switch to general surgery or any other surgery within 1 year. So that kind of freedom and flexibility is there here in Germany. I don't think so it's there in US or UK. You want to take ophthalmology, you take ophthalmology, and then later you find that no, it's ophthalmology is not good for you, or you find difficult getting to ophthalmology and you want to change to some other branch, you can change to some other branch. There's no particular thing. You just have to apply to hospitals and get a job for yourself. Here, residencies are considered as a job and not particularly as a residency. So it's like getting into a job. You'll have to apply to the hospitals as a job applicant. You'll get into the hospitals and you'll carry a logbook where you'll be doing the procedures and everything, and they'll be teaching also. Yeah, standard of living is good. Yeah, so that's the thing about socialist country, where it's not like the rich lives the best life and the poor don't live the good life. No, here all have some access or means to a good amount of salary to have a good standard of living. As a doctor comes into the class of the highest earning in the country. The first main disadvantage is German language. It's not an easy language. We have to master the language really well, because right from history taking till discharge summary, it is going to be everything in German, including the bones, organs, and arteries. It's not going to be like, we don't say stomach how we say in English. It's going to be different. We have to say it in German, which is going to be Bauch. You might say that I'm talking something or I'm talking something wrong. No, that's how it is. Everything will be in German. So if I'm to talk about pancreas, so if I have to tell that to a German, explaining about pancreas. So pancreas in medical German is pancreas, but instead of a C, there'll be a K. Instead of a C, there'll be a K. That's the spelling. So the spelling will also change when you learn the German language. And the language doesn't mean we don't learn only the normal language. You have to learn the medicine language also. So I'll be talking about all those things in the upcoming slide. So history taking. So I have to ask the patient, what's your name, your age, weight, all those things. What is the chief complaints, the presenting complaints, all shock rates, sample history, everything will be in German. So right from asking from what is the pain scale, whether the pain is radiating, aggravating, for relieving, whatever it is, everything has to be in German. And you need to speak a good amount of German so that the patients can understand what we are talking about. So the pronunciation, it differs a lot. So that means we'll have to master the language quite a lot. So yeah, all including the communication between doctors and sisters will also be in German. So the amount of English that I speak in a day is hardly anything. So it's mostly 0%. I only speak in English when I speak to some other colleagues in India, or when I do a presentation like this. That's the only time I get to speak in English. Otherwise, I don't speak in English at all. So my communication every day, wherever I go, to supermarket or any place in Germany, it's going to be in German. It's not going to be in English. Second con is bureaucracy. It takes a really long time to get things done here. I would say a simple example of a transaction, a bank transaction, which we do in India. We send so many lakhs and so many transfers. We do so much of transfers in India, which happens within a minute or seconds. Here, say for example, if I have to transfer today, Sunday night, if I have to transfer something, it won't get transferred today. It will get probably transferred tomorrow night. That's how it is. It will get deducted from my account, but it won't get. So that's the bureaucracy in terms of medical application. Also, it's going to be a long time. So when you send your documents to the state medical council, it's going to get a long time, minimum 6 7 months for you to get a reply telling that they have received the documents. So such long processing time. So why they say because of shortage of workers, but I'm not sure what is the true reason. We all the doctors who have come from different countries to Germany, everyone faced the same thing. It's not about racism. Even the Germans, we do know that bureaucracy is a big problem in Germany because they are not digitalized. Nothing here in Germany is digitalized. Now they're coming to the age of digitalization, of making the documents into digital version. They are taking everything. So if I have to open a bank account or something in India, we can do it everything online. Here I have to go to the bank, fix an appointment to go to the bank. Yeah, I just can't walk into the bank. That's one more thing. So I have to fix an appointment to go to the bank. So that's how it's going to be for each and everything. So if I have to send my documents, everything has to be sent through post, not through email. Each and every document applying for the exam will also be done through post. We apply for NEET exams and everything to online very much, and we do know the difficulty of getting a center, how much struggle we face, the amount of people that we within a minute. It's like Tatkal ticket being booked in India, but in Germany it's more worse. We have to send the post, and it takes time for them to reply back to us telling that which date we have an exam. So that's the thing. And work rules. Punctuality is big thing here. They look into punctuality a lot. In India, we have a lot of flexibility, irrespective of wherever we work, who is a professor or HOD. We have a lot of flexibility at times. But here in India, here in Germany, it's a different thing. Punctuality is a lot, will be seen very particularly. And during the work hours, phones are not allowed. Yeah, we are allowed to have our phones and everything, but when we use the phone, it's seen something as very, very, very rude and very impolite. So we are allowed to have the phones and everything in case of emergency. We are given a separate old Nokia kind of a mobile, which is only for the hospital. It's like a pager, like how they have it in US or UK. But here we are given an actual kind of old mobile, which does not have any internet connection, just to call the other doctors. It's like they say duty mobile or something like that. Yeah, that's the thing. And there's massive documentation when you have to apply to Germany. And the last thing is also, so most of the salary which we get goes for taxes and insurances. I have to even insure my cycle. There are insurance even for cycle, but it's really useful, which you will find out later when coming to Germany. So what are the types of hospitals and what is the healthcare system here in Germany like? So when you're coming to Germany and you want to know which hospital you have to apply to and everything, so there are many different types of hospitals. One is the uniclinics. So uniclinics are like medical colleges in India where we have all studied. So we have a medical college and we have a hospital attached to it. So that is what is medical college in India. But here in Germany, that is called as uniclinics. So they are one type of hospital. The next is community hospital or municipal hospitals, they say. And this is where I work. Yeah, I work in a community/municipal hospital. They are all affiliated to a uniclinic, to a university hospital. Yeah, and they do have residency programs and everything. Yeah, every hospital here in Germany have residency programs. So these municipality and community hospitals, why are they separate without any medical college attached to it? So that they have a distributed healthcare system throughout the country. It does not need much infrastructure. So in India, when we think of medical college, we think of, oh my God, so much of infrastructure, so much is needed and so on. Here they don't want to do it like that. So that's why they have municipality hospitals where they are distributed all over the country, and they all have residency programs, but not undergraduate programs. They all have residency programs for PGs. Uniclinics have undergraduate and postgraduate programs, but community hospitals and municipalities have only PG programs. Private hospitals, there are some amount of private, very, very few private hospitals in Germany. They are like Asclepios, Helios, Rhone, Zana. They're all like Apollo and Rela. Such kind of hospitals are called private hospitals, like here, like Asclepios and Helios. They are such kind of hospitals here in Germany, which are all private hospitals. Where also the residency is free of cost, and it's the same. Yeah, the salaries differ a bit. I'll tell you about how it is. So, what is the duration of time or duration of the residency program here in Germany for a surgical specialty? It's minimum of 5 years. So, if you're going to do general surgery, you're going to do general surgery for 4 to 5 years. 5 years actually. Yeah, it's a minimum of 5 years. So, there's a logbook where every PG will have a logbook, just like how it's in India. Here too, we have to maintain a logbook. So it's more like we have a set of procedures or surgeries which have to be completed. So even if 5 years are over and the logbook has some amount of cases which are still not completed, or some amount of surgeries which still are not completed, that means we cannot complete the surgical training. We need to go to another hospital and so on. And unlike India, where we stay in one hospital for 3 years, other than district rural postings, we stay in the same medical college for 3 years. Here in Germany, it's not like that. So in 5 years or 6 years, you can change 5 hospitals also, 5, 6 hospitals also. So that's up to you. So I'm in a hospital where they do so many endoprothetic surgeries, like hip replacement, knee replacement surgery. They do so many surgeries. Last year alone, they have done 1,400 endoprothetic surgeries, where that was 800 or 700 hip replacement and 600 knee replacement surgeries per day. They do 2 to 3 knee replacement and 3 hip surgeries. So that's the volume they do here. So when I feel that that is enough for me, and I want to go to a trauma surgical center where I want to do more, where there's more of trauma than endoprothetic, so I can go to another trauma center. So that's how it is here in Germany. You can keep shifting to hospitals based on vacancies. We'll have to apply to those hospitals wherever we find that the hospital is good and there is a vacancy also. We apply to those hospitals and we go on. So yeah, but it's a minimum of 5 years. So in 5 years, we have to try to complete the required number of procedures and surgeries and so on. And with super specialty, say for example, trauma surgery in India is considered super specialty. And if you take gastro surgery or you want to become a neurosurgeon, so that means you will be doing 1 or 2 years of 1 year of general surgery. You will have 6 months or 7 months of intensive medicine also. You'll have to do intensive medicine also, and you'll have to do 6 months of some other thing also. So there'll be 1 or 2 years will go on like that, just like how in India also we have such postings. And then you'll do neurosurgery for the rest of 3-4 years, and that's how it will be. And in this 3-4 years, you have to complete the number of surgeries that you have done. So in total, a minimum of 6 to 7 years. In total, a minimum again. So a minimum of 6 to 7 years. So when you're not completed so much of procedures, that means you have to complete it by going somewhere else, and then but mostly everyone complete within 5-6 years, unless and until people say, I need some more time to prepare for the exam and so on. Medical specialty is the same thing, a minimum of 4 to 5 years in case of internal medicine or general medicine. Here there's a difference between internal medicine and general medicine. So in Germany, there is in their healthcare system, they have something called as Hausarzt. They are like family doctors. So every person, even myself, I'm registered by a family doctor here. Although he does not know anything about my family, but that's how it is called, like Hausarzt it's called in German language. So, but in terms of English, I would say he's like a family physician or something like that. So everyone has to be registered with a family physician. So whenever I'm sick or something, I'll go to him, and then he will, in case if he's not going to be able to treat and requires a specialty treatment, then he will write it to another specialty doctor. So that's how it will work. So all those who want to become Hausarzt or this family physician, they have to do general medicine, allgemein medicine, they say in German. And innere medicine is something for the people who want to do super specialty, like if they want to do gastroenterology, they want to do neurology, or they want to do anesthesia or something like that. It's different. So cardiology, they have to do innere medicine. So internal medicine. So it's slightly different when it comes to hospital, the terms of hospitals and the types of hospitals here in Germany.